Afternoon, everybody. Thank you very much for joining our special dialogue session hosted by Global Health Innovation Policy Program at GRIPS. My name is Hiromi Murakami of Global Health Innovation Policy Program, facilitating this dialogue series. We are so honored to welcome a distinguished guest today, Dr. Kenji Shibuya, who has been such an enormous presence in this arena and has such an in-depth knowledge and comprehensive experience regarding this topic. And we're so excited to hear his views about challenges we face with COVID-19 and beyond. Omicron variant is just hitting Japan so hard, and we have been dealing with this COVID-19 for 2 years now. And it is particularly important today to think through what are the real and fundamental issues we have to tackle and what sort of health system we need to build, having had such a COVID-19 pandemic. Today, we're so fortunate to have Dr. Kenji Shibuya, who has been closely following this issue. And especially, he has recently got back from England, where he led Institute for Population Health at King's College London. And also, he has been a senior advisor to WHO Secretary General. And his insights are very valuable. We sincerely appreciate Dr. Shibuya's presence today. For administrative announcement, we'll have Q&A session after his talk. So please submit your questions underneath at this bottom of Q&A column so that anytime during his talk, you can accept your questions. So after we're having a Q&A session, we'll be pointing out your questions appropriately. So please submit anytime you want. And also, we are recording this session and it will be available later at the website. So let me introduce today's speaker, Dr. Kenji Shibuya. Dr. Kenji Shibuya is director of the Soma COVID Vaccination Medical Center in the city of Soma, Fukushima. And also he's a director at the Tokyo Foundation Policy Research Center. He was previously professor and the director of the Institute of Population Health at King's College London. Before joining King's College, he was professor and chair of the Department of Global Health Policy at the University of Tokyo and coordinator at the WHO. Dr. Shibuya has been advisor to both central and local governments. And most recently, he was a senior advisor to WHO Director General and a member of Scientific Advisory Committee of the Coalition of Epidemic Preparedness Innovation, CEPI, a pandemic vaccine fund investing on COVID-19 vaccines. He spearheaded the future strategic directions of the Japanese global health policy agenda at the Hokkaido Toyako G8 summit in 2008 on health system strengthening and Iseshima G7 summit in 2016 on global health security. He obtained his MD at the University of Tokyo and earned a doctorate of public health in international health economics at Harvard University. Let me also introduce Dr. Kiyoshi Kurokawa, Professor Emeritus of GRIPS, Head of Global Health Innovation Policy Program, who is our commentator today. He has long been involved in global health, health policy, and of course, COVID-19 issues. He's a member of World Dementia Council, International Scientific Advisory Committee, and many other institutions. With that, I'd like to pass the microphone to Dr. Shibuya, and we very much appreciate taking time for us. It's all yours. Thank you.
Okay, so good afternoon and good evening, everyone. I was supposed to, I thought I was supposed to do some sort of dialogue, so I didn't prepare anything, but let me just share the quick slides so that I could talk a little bit about some of the issues with regard to Japan. So I've been watching the Japanese response to COVID, but I'm kind of a little bit critical, although I really admire the effort of the Japanese people, because basically what the major driving force to minimize the number of cases or casualties was primarily driven by people's voluntary effort. But in terms of governmental response, in terms of scientific approach, I think we could have done more. So let me start with very basic approaches to infection control. Probably already know already, but there are basically three approaches. One is to disrupt the route of transmission. So wearing mask, proper ventilation, hand washing, and social distancing, and the extreme case is lockdown. The second is to identify and remove the source of infection. So you need to detect, because not everybody is infected, relatively small number of people are infected. But tricky part of the COVID is that asymptomatic people are spreading the virus. It's airborne transmission. It's asymptomatic and airborne transmission. One very tricky part of this COVID transmission. So it is extreme. That's why I think it's extremely important for many people to get tested, and if possible, self-isolate, either other than home. But in the case of Japan, where the alternative facility is not necessarily available, so maybe stay at home for a while would be okay, even though the in-house transmission is becoming an issue. But the important thing is to get tested. Otherwise, you cannot complete, you cannot open up the economy, you cannot maintain the socio-economic activities. But finally, increasing hostility that could be done through vaccination. So before the vaccination became available, and the only way to stop the transmission and up and run the economy was, basically a lockdown or test and isolate, test, trace, and isolate. So when the transmission cannot be stopped, when there was exponential growth of the transmission, the only way to stop the economic crop and medical system crops, the only thing we could have done was lockdown. But now we do have more weapons and also understanding of the fundamental risks associated with COVID. Over 2 years, we have accumulated quite a significant amount of scientific knowledge and some of the cutting edge technologies. But in the case of Japan, even now, the primary strategy was to rely to disrupt the route of transmission. So this is the newspaper article in Nikkei almost 2 years ago. Top experts, still two of them, the major architectures of Japan's COVID response. In the middle, Dr. Omi. On his left hand side, Dr. Wakita, who is the president of National Institute of Infectious Disease. On the right, Dr. Stani, who is the major architect of so-called cluster control approach. In this dialogue, Professor Stani mentioned by referring to the initial response by the Wuhan city, where there was a initial lockdown followed by massive testing. He said, lockdown is a 19th century strategy. And there is an alternative approach to controlling infection through behavioral changes among the general public. Here, there is an initial sign of their idea. So they are primarily thinking that, Japan would take a different approach. And we will focus on people's behavior change rather than draconian measures such as lockdown. But after almost a year since this dialogue, Dr. Omi is asking the government to legislate lockdown. So he said, we will be forced to discuss even the request for the government to legislate the lockdown or things like that. Even if we declare a state of emergency, it will no longer be as effective as we had hoped, which is true. During the fifth wave, last summer to September, the state of emergency didn't work. I wouldn't say it didn't work, but it was quite limited in terms of impact. But the virus had gone. It could be explained by seasonality and to some extent vaccine efficacy, delayed vaccine efficacy, and some intrinsic biocapacity. But still, up to now, the major factor among the experts and around the Ministry of Health, they think people's movement is the major driving force of transmission. So over the years, these scientists, so-called experts, initially they criticized lockdown. Now they are asking the government to register lockdown. So where is the science? Where is the accumulated knowledge about COVID over 2 years in terms of vaccine, in terms of antibiotic, in terms of rapid testing, in terms of measure risk assessment? We have known substantial amount of science and accumulated knowledge about this. But what they are talking about is whether or not they are going to lockdown or not. So I'm very surprised about this kind of mindset. Although, of course, they are not necessarily working alone independently as an expert. That's also a problem. They are working with the bureaucrats and members of parliament. So I think they are part of this entity. But still, as an expert, I think there is something wrong with them. So the early phase, there was the independent investigation among the private people, and they looked at the first and second wave, very early phase of the response, and they concluded that Japanese authorities relied on people's volunteer effort. And still, I think that is sustained. So if you look at current mumble or limiting store hours, restaurant bars, they are doing the same thing. But I don't think it's so effective as before because people are fed up. People think that the fifth wave, without any draconian measures, the virus has gone. So I think people are really, really wary of this. And also there seems to growing distrust between the general public and the expert and also the government. So that is my concern. And also, I'm not criticizing Dr. Stein, but generally, I'm just criticizing what the Japanese government has been doing over 2 years. So he said on the TV, we don't have to find out all the cases to tackle COVID, but we can control COVID by identifying clusters of symptomatic patients. So initially, they asked those who think they were infected to wait for 4 days with the temperature up to 73.5. 4 days fever with 73.5 Celsius. For the elderly, it is a very, very early sign of severe pneumonia. So why you can't just get tested on the spot? And he was saying that Japan is managing the current transmission by restricting access to PCR testing. So when I heard about this over 2 years ago, I was very shocked because it started opposite to what was happening elsewhere. Because unless you get tested, there will be a hospital transmission and transmission among the nursing care facilities. That is disaster. And it happened as we expected. I criticized this, but when I was advocating that eventually to tackle this, when there was no vaccination, the only way to maintain the social-economic activities is for everyone the potential for everyone to get tested. So when I said almost March 2020, and I was heavily criticized by these people, and also I was kind of attacked by the medical community. Oh, Professor Shibuya became crazy once he went to the UK. But I was very confident that when COVID is kind of stabilized, like now, not yet, but very close to the end of the pandemic, and if we are about to resume the socioeconomic activities, the importance of testing will become much more relevant and obvious. So, and also I'm very, very shocked when the health ministry lobbied to restrict the PCR testing around May and June 2020. And I remember Chief Medical Officer right now lobbied in Nagatacho, bringing this slide and table to asking the member of parliament that because of false positives PCR, if you test more, there will be many, many false positive cases, which is totally unscientific. If you know PCR, PCR is very, very accurate, almost zero false positive. But I'm very surprised because these people supposed to be medics and of course a bureaucrat are doing some sort of public infodemic. It's totally wrong. But still, they are trying to suppress the testing, even in the midst of this Omicron, big resurgence. And this is the also, it's not the bureaucrat, but those who are still on the advisory board or government expert committee, they created a voluntary group of government experts, and they are putting on the website. So they said self-care at home, stay home for days, don't come for testing, and negative proof by PCR is not scientifically relevant. And now they just deleted the site. A friend of mine just sent to me. But this is the kind of status of the expert, what they did almost a year ago. So I'm not criticizing, I'm just taking the fact. So when I was very shocked about the Japanese response to COVID, particularly restricting the PCR testing, I called up Professor Nagai, Ryozo Nagai, and also President President Yokokura of Japan Medical Association, because I thought, as everybody criticized me, I thought I was not clear whether or not I was wrong. So I called them, and Professor Nagai is also very furious about restricting testing, so was Professor Yokokura. And they asked me what to do. And in the UK, there is, official scientific advisory group or emergency, which is called SAGE. And also there is an independent SAGE. So there are two groups of people. Both are fantastic experts, and they do a kind of democratic open debate. So important thing for the science community is to put everything on the table, and through the debate, we'll agree on the consensus. Of course, there should be a bunch of uncertainties, but the important thing is to have a healthy debate. And also I'm very surprised at the time, only one modeler presented his own model to inform policies. But in the case of UK, there are 5 or 6 group of fantastic world-class modelers working together, but also they are competing with each other. And 5 or 6 models will be presented at SAGE, and member ministers or PM, Prime Minister, will eventually make a political decision. But in the case of Japan, still, I think, it's changing a little bit, but still, very few modelers, the models are presented. Models are models, it's just for scenario options, but, and also I'm very surprised policy proposal that 80% of contact will be reduced. It cannot be a policy message, because it is like a mathematician saying, to reduce R, that's a reproduction number, by reduced by 80%, and maybe the bureaucrat might translate into 80% reduction of contact. But we are living totally different life, and risk exposure is very substantially by age, by occupation, by environment, and risk of transmission very substantial as well. So just across the board, 80% reduction in contact. It's just meaningless, right? So even last 5th wave, reduce 50%, reduce outgoing by 50%. What is it? Is it a policy message? It's just a mathematical, they are just playing the numbers, or they are just playing the models, which have no reality on the ground. So that has been my criticism. But so going back to the issue about independent expert panel, so President Yokokura at the time of Japan Medical Association agreed to set up, expert committee. So he set up the JMA expert committee, and one of the committee was on PCR, and I was invited to join this. And that group included real experts on testing, epi, and clinical medicine, and laboratory as medicine. They're fantastic people. And we concluded that testing should be done regardless of prior probabilities to control infection and maintain socioeconomic activity. Because those who are criticizing, there are a bunch of people, but I was very surprised because within the medical community, particularly those working at the hospitals, those doing clinical medicine criticize the PCR. Because when there is the prevalence of infection was low, i.e. prior probability was low, there is no point to implement PCR. That's also true from the clinical diagnostic viewpoint. Because if you see a patient at a patient clinic, if the probability of certain disease is low, you don't have to do testing because we can exclude by oral history, taking a physical exam. That's clinical diagnosis. So that relates to prior probability, and those who criticize that if prior probability is low, you shouldn't do further testing, which is true for clinical diagnosis to diagnose whether the virus is in your body or not. But we are talking about the control of transmission. We are talking about how to maintain the social activities. The issue is not whether we will clinically accurately diagnose the patient that there is a virus within the body. We would like to see whether there is infectiousness, meaning is there a virus in your saliva? That's all about it. So it doesn't matter whether there is prior probability or not. The important thing is whether if the testing kit is accurate enough to detect the virus in the saliva when there is virus shedding is extremely active. So for that purpose, PCR, so as a rapid antigen test, the latest rapid antigen test, a fantastic tool to serve the purpose. So still the ministry is saying that we are running out of testing capacity, but it is obviously consequences of their public government infodemic to restrict the testing. And their fundamental role was first mixing up the accuracy of PCR and also its quality control. And secondly, they are mixing up clinical diagnosis issue with infection control or maintaining the economy. Now finally, they completely ignore the importance of asymptomatic and airborne transmission aspect of COVID. So they are focusing on symptomatic cluster of people and do the contact tracing, cross contact, but it's airborne transmission. So there's no point to just focusing on cross contact. They have slightly changed the tone, but up till last fall, they have never acknowledged the term airborne transmission. It's shocking, the extent of the science. In terms of vaccination, do you remember when we were talking about the Tokyo Olympics, the vaccine coverage was, so I'm talking about Japan model with respect to testing, vaccine, and hospital beds. But in terms of Tokyo Olympics, the coverage was around 23%. But now I think I really like to admire the leadership of ex-Prime Minister Suga and the Vaccine Minister Kono. The vaccination coverage just amazingly increase over the next 4 months. And by the end of November, I think its coverage was over 75%, and probably currently is the best among the G7 countries. So I really admire the administration on that. And I have been working in Soma City, Fukushima, to support their vaccine rollout. And probably Soma City is one of the fastest municipalities to complete the second dose of vaccination. We completed by 13th of July, very early for everyone, not everyone, but more than 95, nearly 95% of the population, including young kids eligible for vaccination over age 12. But the bad thing about early adopter is waning of antibody. So we are, when we finished the vaccination in July, we had a new news from Israel that they are going to start, or even the UK, they are going to start the third booster, because it was clearly shown that after 6 months, the antibody, particularly among the elderly, among those who have a basic condition, the vaccine titer was rapidly declining. So we had a meeting in Soma with mayor, and we decided at the time that we have to prepare for the booster, because we completed the flu vaccination in July, and the elderly was done in April or May. So by November, there is a huge risk that these people will be affected unless they got boosted. So we started the lobbying with the Ministry of Health and also the Cabinet Office, and that we should prepare for the booster. It was around end of August. And then their reaction was like this: oh, we have not yet finished second shot in many municipalities, so we cannot allow Soma City to go ahead. And we don't have Japanese data. So all the data about antibody waning was from the abroad. So yeah, usual kind of excuse. So we spoke with the mayor. So why don't we just do our survey and ask the public in Soma and Minami Soma to give us blood and measure their antibody titer. So we did it with the support from Dr. Tsubokura at the Fukushima Medical University. And we checked the antibody titer a couple of times. And he clearly showed in October that after 3 months, since the end of the second shot, the viral antibody was declining very quickly, particularly among the elderly. So we asked the mayor to bring this to the Prime Minister, Kishida. And on the spot, Kishida promised the mayor that start the vaccination, a booster, within the 6 months last shot. But all of a sudden, the Ministry of Health and others did a compromise, and they started saying that, in principle, 8 months is the minimum length since the second vaccination. So we got stuck because many elderly in Soma City got shot in April. If we wait for 8 months, we are expecting the sixth wave by the end of November or early December. Given this seasonality, we don't trust modelers because they just screw up. So we are expecting the sixth wave is coming, despite people were enjoying. Oh, fifth wave is gone, everything's fine. COVID was gone, but we are worried about this because of the seasonality, the waning of vaccine effectiveness. We predicted that the next wave will soon to come back by the end of November or early December. So we continue to negotiate, but they stick with the 8 months rule. And then Omicron came in as we expected. It can be simply, if we look at what is happening outside Japan, Omicron started to increase in October, November in the UK and probably in Europe and the US. It was about time for Japan to be, affected. But they reacted very late. And when Omicron started to increase exponentially, they eventually said, well, 8 months rule to be, lifted so that you can start the third booster after 6 months since the last vaccination, which is just nonsense. So we have started the vaccination since last week, and over last weekend, the 50% of those who are aged 65 or over are already vaccinated in Soma, luckily. So I expect this Omicron, the peak of Omicron is very fast because this the generation time of Omicron, that is the length of time since the first infected people to pass on the virus to the next, is shorter compared to Delta. Therefore, the peak will be faster and the waning will be also faster. So there will be a very fast, steep peak in terms when it comes to Omicron. So I think lots of models predicted that it will be around early or mid-February. So we are rushing to vaccinate these high-risk groups before this peak. But if you look at other municipalities, particularly the area in other municipalities, I don't think the vaccination is started. Just 2% of the Japanese population are boosted. So how could you prepare for the Omicron, despite lots of experts warned that because of the seasonality, the next wave was about at the corner. So now, what you cannot just start a booster right now. It's too late because Omicron will peak out in next month, and then after a couple of weeks, there will be a sudden rise of hospitalization and some deaths. Not too much compared to the previous wave, but there should be a bunch of people to be hospitalized because not many people are vaccinated. But there is very limited thing we could do except mumble. Reducing the opening hours for bars, which is just damaging the economy. It's not science. The science is get boosted, get tested, ventilation and wear a mask, and of course prepare for the hospital beds. Plus oral antivirals. It's clear. With these weapons, we can maintain the economy, open up the economy. Although we may see the cases, but now we can disrupt the linkage between case and hospitalization and death with these scientific weapons. But still, the government is relying on people's volunteer effort. I really admire the Japanese people's patience, and they wear masks. They are very cautious about contact, and they follow some of the guidance. But in terms of mumble thing, and in terms of restricting restaurant bars, I don't think it's or rather that is just damaging the economy. So I thought when I was asked in November, what's next? So I said, the next wave, which is Omicron right now, will be a test case because we have all the weapons to control COVID, although we cannot now eliminate COVID. We don't have to because we have vaccine and all our antivirals. So we don't have to lock down because with these weapons, we can prevent crops resistance. So vaccine, testing, wearing masks, ventilation, we can maintain the economy. So as the schools. That's what I told many reporters. But nothing was seriously taken. And now, surprisingly, experts are saying we don't have to test the young people. And also, President Omi of this Bunkakai subcommittee said that people's flow doesn't matter. Working at home is not working. A lot of number of people eating at the restaurant does matter. So where's the science? So I think they are completely confused or politicized. I don't think they know what they are supposed to do, because we know how to maintain the economy, and this will be probably still there should be some surge, but I think the end of the pandemic is obviously in sight. We have a hope. Still, of course, we have to tackle this, the Omicron. But a final issue, what I'd like to discuss is why is Japanese health system so fragile? This is a little bit old, but the COVID cases was much lower than other countries. Only left quadrant, upper left graph is the number of cases per 1,000. Of course, the testing is very limited, so this is a highly underestimated. Still, the cases were much lower than those in other countries. Hospital beds are much higher. Of course, that counts in mental health hospitals or nursing care type of beds in Japan. But in terms of doctors, nurses, more or less the same with other countries. So why Japanese hospital cannot cope with COVID? And the usual answer is, oh yeah, because it's run by private hospitals, very small and fragmented and differentiated. Yes, we have known this issue over the decade, but that's not a major issue because this can be changed with the usual medical reform. But the fundamental problem this time is that, I'll explain. So we have 250 cases, deaths at home. They were literally left out at home in August because there were no facility for them to be admitted. It's shocking. Japan is the country of universal health coverage. Those who are in need will receive the proper care at a affordable cost. But this clearly shows universal health coverage in Japan is no longer functioning well. Well, of course, people say, oh, because it's Delta, or because it's COVID, it's an emergency. But that's not the issue. Because if you look at the fundamental problem of this lack of medical beds, primarily due to the fact that major public, not private, public hospitals were not accepting COVID patients. It's shocking. This is data I got from Shiozaki, ex-health minister Yasuhisa Shiozaki, and this is the hospital names. The National Hospital Organization, nationwide, also Japan Community Hospital Organization, JCO, who's president, Dr. Omi. And the proportion of beds allocated to COVID patients were just nationwide, National Hospital Organization, just 4% of their beds were allocated to COVID patients. Just 4%. JCO, just 5%. And out of which, only 42% were actually used. So that means all these big public hospitals, they just allocated and used for COVID, treating COVID patients, just a few percent of their total beds. In the case of the UK, for example, King's College had 3 major university hospitals, one of which is called St. Thomas Hospital, which is located across the Thames, across the river, with the Big Ben. So when Boris Johnson got condition got worse, so they rushed to our university hospital and put him in the ICU. But that hospital with 750 or 800 beds, they transformed their beds, 40% or the 30 to 40% of their beds were transformed to take care of COVID patients in a week. Of course, the system will be different, and the majority of big hospital, 80%, 90% of public in the UK. But still, Japan does have major public hospitals, and we don't have to change any law because the registration at the time of setting up this new organization clearly suggests the Minister of Health could ask these organizations at the time of public health crisis to respond. So you don't have to change any legislation. The fact is they didn't accept COVID patient. So isn't it shocking? So I asked why, but they just didn't want to do that. So this is the, when Shiozaki stepped down, he wrote in Sentaku. In the editorial, he said, I regret that we couldn't change the infectious disease law because July 2020, just 6 months after the initial, almost 5 or 6 months after the initial COVID case in Japan at the time of Dan Princess, and after 6 or 5 months, we started working to identify what are the fundamental issues. What's wrong with this testing? What's wrong with this cluster control approach? Why there is a so major gap between medical community and public health? So we came to the conclusion that it was primarily due to infectious disease law, which was set 120 years ago. That old system still haunting our response to COVID. For example, it's shocking that public health is focusing on active epidemiological surveillance and cluster control. It is clearly written in the ID law. But there is no connection between that approach and medical care. In the case of UK, under the National Health System, NHS, everything is done under NHS, medical health care. For example, testing, if you just, if you have a suspicious of COVID exposure, or if you have a symptom, if you use your iPhone or website and ask the NHS to send you a home test kit, they can just send to you. And then you send back, and they just inform by text. If you are positive, you'll be instructed to seek medical care, stay at home by NHS. And if you have some symptoms, and if your saturation is, for example, getting worse, 95 or 90, I don't know, but you are asked to go to the hospital, or you are asked to admit to the Nightingale Hospital. It's a field hospital, temporary hospital. And if your condition gets worse, if you need ventilation or intensive care, you'll be referred to the university hospitals or big hospitals. So everything from testing, what to do when you have a test positive, and when your symptoms get worse, moderate case or severe case, everything is done by healthcare. Japan, in the case of testing and in the case of the mild case to be referred, it's done by health centers or public health. How could health center offshore could take care of these cases? And also there is no information exchange between public health and medical care. So that was clearly the fallout of this infectious disease law set by 120 years ago. The purpose of that law is to protect the nation. It's a security matter. And also find out all these infected people and get rid of them. So that kind of quarantine and that kind of old mindset was the fundamental issue behind this law. It's totally out of date. So we knew that if this is continued, there will be a disaster because there will be a gap between the public health and also admission to the hospital. There is no coordination between which beds are available and where to send the patient. We knew from the beginning. That's why, ex-Minister Shiozaki, who was the chair of the governance working group at LDP, ruling party, he tried to change the infectious disease law. And he passed the Seicho. Seicho is the LDP's approval process, and sent to the ministry for revising it, the fall diet around October, November 2020. And they completely ignored. So that's where we are. So we expected this disaster of the fifth wave, lack of hospital beds, as expected. So, this is a really bit harsh what he wrote in this editorial, but I think he's right because he was the only person who opposed to the proposal to leave mild patient at home and which suggests deteriorating policymaking process. It's true because how could people say that we should leave the patient at home without any care? The fundamental task for them is to protect the people. And eventually, and in the end, he said, policymakers do not respect experts and use them for their own objectives, which is true, even right now. And experts are also not necessarily competent, which is also true to me. So that's what he said. But I'd like to conclude my talk. It's really, I'm not criticizing the government, but I have just to share the information, what I have experienced. And to summarize, so Japan's model was primarily relying on people's voluntary effort to disrupt the route of transmission. And Japan model was not necessarily significantly valid, but kind of anecdotal and political, and reflecting the pre-existing governance and system failure. And it is essential to shift from people's voluntary effort to scientific and precision public health approach using testing, vaccination, or if necessary, drugs, and of course, appropriate risk assessment. By doing so, we can manage COVID now and open up the economy. And this Omicron could have been a good test case for Japan to implement, or at least discuss openly with the general public. But what they are trying to do is to declare mambo, and again, punishing rational bars unnecessarily, and giving people the fear rather than the sense of security or safety. So I'd like to conclude with this famous message from Kishikokawa, who is here. But I think this issue is more or less the same. He concluded in this famous Fukushima nuclear accident report, he wrote, its fundamental cause are to be found in the conventional Japanese culture. Our reluctance to or obedience, reluctance to question to authority, devotion to sticking with the program or status quo, about group thinking, our anxiety. And also he went to say that this led bureaucrats to put organization interest ahead of their paramount duty to protect public safety. Doesn't that sound familiar now? So I'm I'm not so optimistic about in terms of lessons from this COVID, because we see the hope now, a year from now, that the pandemic will be ended, although COVID will be still circulating, but we know how to manage COVID and how to run the society. The fundamental right now is the next issue is how to open up the school. But what we could do to open up the economy and also open up the school is the same: vaccination, testing, if necessary, use drugs, and ventilation, wearing mask, and of course, trying to revise the ID law, infectious disease law, to secure the bed. We know what to do, but given this mindset, given this governance failure, people will soon forget what has happened. But I think this COVID, we really need to review what went wrong and what worked over the 2 years. And I think it's time to start serious discussion about how to manage COVID while maintaining the social economic activity with the general public. When I'm working in Soma City, and every day I go to lunch and people try to talk to me, and they are very, very, of course we have some Omicron cases, but they are very confident that Soma, of course, if Mambo is declared, we have to follow, but Soma's people are very happy with what we provide, particularly scientific approach to protect them, given the sense of hope and security and safety to the people. I think that's the bottom line of what the government and also public service should do. But these days, the reason why I'm working with the municipalities bottom-up approach is that it's very difficult to lobby and change the national or central government because they know the problem, but they cannot do anything. So instead, I think the time has come for each municipality or each private company to protect themselves by themselves. So we have to be prepared, but there should be a way for us to exchange ideas through this kind of forum and also share lessons and prepare for the next. Otherwise, I think we repeat the same mistake as Fukushima disaster. Thank you so much.
Thank you so much, Dr. Shibuya. That was very stimulating and somewhat sort of you confirmed some of the criticism and speculation about the Japanese dealing with this issue. And then we're very concerned having heard, your sort of institutional failure of Japanese system. And maybe I can ask first question. We have several questions already posted in Q&A box, but I'm a little bit disappointed with the Japanese institution is not really comprehending those healthy debate at this modern time that, a lot of people went outside and, study overseas and have known, what the scientific, front, what they can be used. But as you said, the mindset of Japanese institutions is so old, represented by the infectious disease law. But how can we improve, to deal with the next crisis, health crisis? Because as you said, COVID-19 will be over soon, but the system stays the same, mentality stays the same, then we don't have any, future responding good institution. But how do you see that?
Well, I think the fundamental problem is that, for example, the scientific knowledge is spreading very fast. So every day I exchange ideas with folks in the UK, Singapore, Hong Kong, or Thailand, or Africa. It's easy because you don't have to join the advisor board or prepare for nonsense piles of papers. But these scientific knowledge can be shared very easy, even if the general public could do. So you cannot stop this kind of sharing of the fundamental scientific knowledge. You can hide it. So that's one. The secondly, I think, these days, the science, the power of science is more relevant because it's not the hierarchical top-down national Ministry of Health at the top, followed by National Institute of Infectious Disease and the health center or related expert. Because what we know, we really need to understand is genetics or data science. If you look at the number of major publications in terms of COVID, very few publications from Japan because they don't disclose data. They don't share data, and they don't have a capacity to collaborate with outside experts. So, and then related to the first point, open up the things and flat type of working relationship, and also again, each municipality, each company has to take care of themselves. And I think it's a good time for more democratic or more trust-based or more merit-based entity will emerge. So I'm not so pessimistic about, if you take a crack at these people living in the village, it's a waste of time because they're happy with living within the village and they will never change. But what we could do is to bring in the new breath, new fresh voices, particularly those who are very competent young people, foreign people, or minority, or civil society. There are a group of really competent people in Japan, so I'm very impressed when I talk to them. So on that, I'm not pessimistic. I'm actually optimistic about the prospect of these people. The issue is, I would like to pass on this to Dr. Kurokawa, but the platform and also the post are occupied by these old. I'm not saying about age. In terms of, I'm talking of mindset, occupied with these village people everywhere. So that's a problem.
Thank you. I have a couple of questions. So quickly, before going to Dr. Kuroka's comment. So one question.
Testing? Yeah, I'm just checking Q&A.
Okay. One question is, can you comment on the wisdom of Japan's ongoing border control measures for foreign businessmen and students?
Border control is just by time, but when you find Omicron at the border, you have to assume that it's already in the community. And also shutting down the border is just damaging the economy. So we know, of course, we cannot minimize because already there is a community transmission here and it's a big surge here. So it's important to do a proper border control, but it's no longer effective. So shutting down the border right now is, I think to me, it's damaging the economy. Next one is...
Yeah, next one is from a question from Ando-san.
Oh yeah, so the current government said there's no point test everyone. So, but I have to ask, I'm not talking about, but what's the alternative? Unless you know who is positive or not, there's no way to stop transmission because vaccination is not necessarily 100% protected. So if you would like to make vaccine testing package more effective, the only way is to make sure that everybody is get tested. So I'm not saying that I'm talking about ideal world. So before you go to office or school, you just do a quick rapid antigen test. If you are negative, you can go. And if you test positive, you can wait for the next couple of days. And if you repeat the test, if you test negative, you can go back. That's what Singapore is doing. Yeah, of course, Omicron's virus shedding might be longer. So maybe you may need 3 to 5 days, but 5 days will be enough if you test twice or 3 times. So the importance of testing is probably much more relevant than ever. But you think about President Biden's promise to provide free rapid antigen tests to everyone. Of course, it's a political gesture, but I think it is also backed up by the science. So the expert and the OMI announced that young kids shouldn't be tested. I simply don't understand because how could you distinguish COVID from flu, common cold, what other sort of stuff? And how can you ask, because there are also asymptomatic people to be aware of their infectious status and stop behaving badly. So I simply don't understand why they are saying like that. And I think they deleted that sentence in the finally published version. And I'm sure that they negotiated with bureaucrats, they took into account, they diluted the message, but that itself suggests that they are not really expert. Because if they put their name on it, they have to be responsible for what they have written. Because it was already, I think it was named on the paper, on the strategy paper. And it was not published for a while because I got the original one from the media people. And it was clearly there that young people shouldn't no longer test it. But in the published version, officially on the ministry website, it was deleted. And the tone of each sentence was diluted in a very bureaucratic manner. So there should have been intervention from bureaucrats. And if I put my name on it, that kind of document, and if bureaucrats intervene and change the tone, change the direction of our scientific contents, I will remove my name. But they didn't.
Another question is, what is the main cause of shortage of PCR tests?
Because the government, continue to listen, not government, Ministry of Health bureaucrats, not all of them, medical part of them, are still opposing to expanded testing. So that's why. Money is there. And the Minister of Finance, and particularly Minister of Finance people, those who are rational, are very supportive of what I say, for example, from the beginning. And they try to increase the PCR testing. In fact, when Prime Minister Kishida was running for the Prime Minister election, he promised the general public that free PCR will be provided, right? And then it was compromised in due course by medical part of MOH. And then I was hoping that the rapid antigen test will be provided for free, but it ends up with the rapid antigen test was sold at the pharmacy, right? So it's sort of different. So the fundamental issue is the lack of political will, particularly blocked by the ministry, and money is not the issue. Testing kit is not the issue, because when 2 years ago, when there was a common excuse that, oh, we don't have a people, we don't have a testing kit, we don't have a capacity. I checked the private sector, private laboratories. There are more than necessary testing kits and machines. So all these craps, sorry, all these excuses are just an excuse. So I think it's about money and it's about political will. So still the ministry front, Ministry of Health front, they are, I think, reluctant to expand the testing. I don't know why.
One question came from audience previously, so let me ask one. So she asked that you have seen many other nations, including UK, and what sort of the commanding order, who is in charge to deciding sort of this COVID-19 policy in each nation, and what do you think that could be applied, can be learned from their experience?
Of course, different nations have different style, but eventually it's politicians who make a final decision. And scientists should provide all the scientific evidence and options for them to inform the politicians. And even the UK, things seem to be very rational, but it's very political. So, and of course, politicians' interest is to win the next election and also get approval rating higher. That's the same thing. But the problem is, in the case of Japan, I think the experts are internalized with this political decision process. And now the expert committee, the place where the political decision will be endorsed. So it's very difficult to be independent in Japan. But I'm not saying it's not possible. It is possible. But the way the governance is managed right now, particularly under this old style infectious disease law, which was set 120 years ago, was a major problem.
Thank you very much. So I have another question, actually. So let me ask you before he's coming back. So what is actually the fundamental public health agenda, even after this, passing this pandemic? What do you see the major agenda for public health?
In public health in Japan, or
public health in global arena, including Japan?
Because the COVID is nothing new, and COVID just revealed the fundamental existing system failure globally, but also particularly in Japan. So, for example, I think now in the case of Japan, general public are gradually aware that Ministry of Health is not working well. They are really overwhelmed, and they are not necessarily scientifically right. So are Japan Medical Association. So I think regaining trust will be quite difficult, but I think it is absolutely necessary among the general scientific community and the public health arena. So people tend to politicize this kind of stuff at the time of emergency, which is reasonable because it's politics. But I think regain trust among these stakeholders and reshaping it would be very hard, but I think it is absolutely necessary because we are really divided unnecessarily. So how to heal the tension, how to regain the trust, how to mobilize and bring everybody back on the table. We need some serious thinking about it. If you look at the US, sorry for those who are from the US, it's like a civil war, no? Completely got divided unnecessarily. And that is really, there is a spillover effect across the globe. And even Japan, there seems to be some early sign of division, not necessarily COVID, but this will continue, and public health cannot be separate from the general overall societal aspect. So I think regain trust will be very, very critical and difficult.
どうこれは
聞こえます。
聞こえるでしょう。
はい。
English だね。
Okay.
I don't know what's happened in this connection, but I think I really enjoyed your issues. And also thank you quoting our sort of final conclusion of this thing. I made the same comment in some of the public servants in the subcommittee, and this was the same with Fukushima. The reason they cannot respond as appropriate is they never expected that to happen. So they're not written in a law. And what happened there was something invisible, virus and radioactivity. So if that's not written in law in detail, our bureaucrats' brain do not work, and they don't know what to do. When something happens, like breaking, sort of falling some building or something tangible thing, they respond. But this time it's not visible, not in the law. So that was the same message. That is the reason I think they are paralyzed what to do, because you have to keep measuring things to respond. But PCR was so low compared to other countries. How to make any decisions, what to do? So that's the question. Yeah.
Are you optimistic about their future, the bureaucrats?
No, because as you said, so this become a big, much longer decision, because do we really, do you think Japan is really controlled by democratic system? That's my question. Yeah. The same. So if minister had to make a decision, I think civil servants have to make the best scenario, either this or that, and make him to make a decision. That's my argument. So that because of Japanese success from Meiji time and post-war time, I think we think this is a norm. But my argument, like you, and also Murakami-san also spent some time as an independent person in abroad, they begin to question whether we really built our nation as a sort of democratic system. So that's the reason. Like, so I started studying history of Western democracy, this or that. So there must be some tradition of big fight to sort of dynasty by kings to democracy. That is a different thing. That's my argument. That's the reason, same response, same core issue revealed by Fukushima and Corona.
Okay, so do Dr. Shibuya have a final comment?
I just want to thank you about, there seems one question about the masks and this plastic curtain thing. We have to continue to wear masks because it's really effective. But in terms of plastic curtain, it's just useless. It doesn't protect anything because they are just putting that to show that they are following the guidelines. But scientifically, there is no evidence of that. So I agree that we have to remove this nonsense plastic curtains. Thank you.
But it's become a bit more expensive. So somebody's working on this thing.
Spend more on the CO2 monitor or ventilation stuff rather than
right. Right. That's a good point, but I really enjoyed your presentation. Great.
Thank you very much, Dr. Shibuya. And I hope that, Soma model will be soon spread around Japan so that all of the rest of the Japanese system will become Soma model. And we very much good luck to Soma activities.
Yeah.
And we hope to hear back again from you soon.
Yeah, we will finish the booster. We will finish the booster very quickly. Probably the fastest. So,
okay.
Yep. Thank you.
Thank you. Thank you very much for everyone joining our GHIPP session. We're closing this session today, and we'll announce the new session whenever it's available. Thank you very much.
Okay. Thank you.
Thank you.